like an elderly patient who broke their hip,
Yeah.
and they're devastated. Their biggest fear came true, that they fell down, they can't walk, they can't move. The surgery is designed so that you're up on your feet the next day, which is wild.
Wow.
And you see kind of how incredible that is when you're, seeing patients in the emergency department, and then you perform surgery the next morning. That's, not terribly long, maybe, sometimes an hour, sometimes an hour and a half. And the fixation that you provided them enables them to walk the next day.
Yeah.
That's huge.
Yeah.
I mean, when you see that early on in residency, that's really inspiring.
Would you say that those kind of moments make it worth it?
Those kind of moments are great.
Yeah.
Those kind of moments are great. In residency, it's tough because you might perform a surgery, or you might see someone in the emergency department, get them teed up for surgery, do the surgery, but you don't see them 6 months later, right? Because you're on a different rotation. But, you see them kind of getting ready for discharge a couple days later.
Yeah.
With their family, and they're like pumped to get home.
Yeah.
That's pretty cool.
Are those rare, or would you say like you've
That happens
seen
all the time.
Really?
All the time.
That's great to have that fulfilling, side of it.
For sure, yeah. And total joints, so like doing total hips and total knees.
Yeah.
These are people coming in, they can't walk. They've had debilitating hip pain for years. They're nagging their spouse. They can't walk. They can't do the things they want to do. And then the surgery, total hip replacement is really dialed in, efficient surgery. And patients are leaving the same day after surgery, a couple hours later, and they're leaving with not just like a little bit less pain, but new hip joint, and like no pain. That's great. Incredible.